Have you been diagnosed with insulin resistance or type 2 diabetes? Diabetes may not even know that they have diabetes before they see these signs on skin. Treating skin infections timely is very important, otherwise it may progress to serious life-threatening conditions. It may be very difficult to treat in late presentation. Especially when you have these features, I'm talking about 10 signs of poor diabetes control or insulin resistance on your skin. As a dermatologist, it's very common to have skin signs in diabetes, especially poorly controlled patients. We are talking about skin manifestations of diabetes or insulin resistance, and as you know, skin is one of the many organs that can be affected by diabetes. Diabetes may actually have high blood sugars due to uncontrolled diabetes, or they may not even know that they have diabetes. Before you see these signs on your skin or someone else's skin, make sure you watch the entire video. Because I promise you will learn something new today and how to self-care about some of the conditions. Number 1. Darkening of creases and velvety feeling commonly over your neck, groin and armpits. These dark patches of skin that may indicate you have too much insulin in your body. This is very common with prediabetes as well. This is called acanthosis nigricans. That's the medical name for the skin. This may be the first sign of insulin resistance. What can you do to this rash? Weight reduction and exercise will help to minimize acanthosis nigricans. You can also try tretinoin cream at night, which will reduce the dark color. That morning you can apply keratolytics, like salicylic acid creams. It's helpful in reducing skin thickness and lighten the skin. Creams containing glycolic acid, which contain alpha-hydroxy acids, also help to exfoliate the skin and reduce the thickness of the affected areas. You can use glycolic acid or salicylic acid with tretinoin at night for better response. Tretinoin is contraindicated in pregnancy, so don't use it if you are pregnant. Number 2. Diabetic dermopathy. Diabetic dermopathy is a common skin condition that affects people with diabetes, also known as shin spots. The condition appears as round, brown or reddish-brown patches on the skin, typically on the shins. These patches are usually asymptomatic and do not require treatment. However, in rare cases, they can become itchy or sore. Diabetic dermopathy is thought to be caused by changes in the blood vessels and connective tissue in the skin due to high blood sugar levels, which can cause damage to the small blood vessels that supply the skin. Good blood sugar control is important in preventing and managing this condition. If you notice any changes in your skin, it is important to consult with your healthcare provider for proper evaluation and management, because you also having eye problems and kidney problems, and you may be unaware of. Number 3. Necrobiosis lipoidica. Have you heard this name before? It causes thinning and discolored patches of skin, usually on the lower legs. It may be yellow, brown, or red, and may have a shiny, waxy appearance. Skin rash may also be raised, firm, and itchy. In some cases, the patches can develop ulcers or become infected. People with poorly controlled diabetes are at higher risk for developing necrobiosis lipoidica. Treatment options include managing blood sugar levels. This is the most important one, your blood sugar control. Using topical steroids to reduce inflammation, and wound care to prevent infection. In severe cases, other treatments such as phototherapy, skin grafting, or medications that suppress the immune system may be recommended. If you suspect that you may have necrobiosis lipoidica, it is important to consult with your healthcare provider for proper evaluation and management. Number 4. Scleroderma diabeticorum. This is typically affecting individuals with poorly controlled diabetes and characterized by thickening and hardening of the skin in the upper back, neck, and face, resulting in a waxy appearance. While there is no cure for scleroderma diabeticorum, treatment options such as controlling diabetes, physical therapy, and corticosteroid therapy may provide relief of symptoms. If you or someone you know is experiencing symptoms of this condition, it is recommended to consult a healthcare professional because it's an indicator of poor blood sugar control. Number 5. Diabetic bullae. Diabetic bullae can occur in people with poorly controlled diabetes. It is characterized by fluid-filled blisters that develop on the feet, hands, legs, and forearms. These bullae can be quite large and painful, and they often take longer to heal. It is thought to be related to the underlying changes in blood vessels and nerves that occur in people with diabetes over time. The risk of developing diabetic bullae can be reduced by maintaining tight control of blood sugar levels through medication, exercise, and a healthy diet. The treatment of diabetic bullae primarily involves managing the symptoms and preventing infection. The blisters should be kept clean and dry, and it is recommended to avoid popping or draining them yourself, as this can increase the risk of infection. It can be pop-up with sterile needle, and antibiotic creams can be applied. Number 6. Eruptive xanthoma. Eruptive xanthoma characterized by multiple, small, yellow or tan-colored bumps on the skin that are usually surrounded by reddened skin. It tends to occur in association with high triglyceride levels in the blood, which can be caused by uncontrolled diabetes. The primary treatment for eruptive xanthoma involves lowering blood triglyceride levels. This may include implementing dietary changes such as reducing the intake of saturated fats, trans fats, and sugar, as well as introducing more fiber-rich whole foods like fruits, vegetables, and whole grains. Weight loss and regular exercise may also help to reduce triglyceride levels. In some cases, the healthcare provider may prescribe medications such as fibrates, niacin, or omega-3 supplements to help lower triglyceride levels. Managing the underlying diabetes also help to improve the skin condition. If you have these, there is high risk of heart attacks and cardiac arrests. So be vigilant about these. Number 7. Acquired perforating dermatosis. Have you heard this before? This is characterized by the appearance of small, firm papules or nodules on the skin which undergo central necrosis and then become crusted. These lesions can cause intense itching and may be accompanied by an unusual sensation of being crawled upon by insects. The treatment of APD is usually divided into controlling the underlying high blood sugar. Also, diabetes with kidney dysfunction are at high risk. Topical emollients, antihistamines, and phototherapy may provide symptomatic relief. Additionally, systemic treatment with retinoids, oral corticosteroids, and antihistaminic agents have been shown to be effective. Number 8. Diabetes can affect the skin in a variety of ways, making individuals more susceptible to skin infections. Two common skin infections include bacterial and fungal infections. Bacterial infections, high blood sugar levels, and poor circulation can impair the immune system, making it difficult to fight off infections. Bacterial infections that may occur in individuals with diabetes include folliculitis, carbuncles, styes, and cellulites. Antibiotics are generally used to treat bacterial infections. Fungal infections, yeast and fungi thrive in warm, moist environments, which can be created by excess glucose in the blood and reduced circulation. In individuals with diabetes, fungal infections can occur on the skin, nails, and mucous membranes. Common fungal infections include ringworm, jock itch, athlete's foot, and vaginal and penile candida yeast infection. Topical or oral antifungal medications are usually used to treat these infections. To prevent skin infections in individuals with diabetes, it is essential to maintain good blood sugar control, practice good hygiene, and promptly treat any minor cuts or scrapes with antiseptics. If you suspect a skin infection or have any skin concerns, it is important to consult a healthcare professional for further evaluation and treatment. Delay in presentation may threaten your life. Number 9. Granuloma annulare. This is characterized by the appearance of raised, reddish, or skin-colored bumps in a ring-like or circular eruption that may be itchy or asymptomatic. The lesions usually occur on the hands, feet, or ankles, though they can appear anywhere on the body. It is thought to be related to a delayed type hypersensitivity reaction or an autoimmune reaction. In most cases, granuloma annulare is harmless and does not require treatment. However, if the lesions are widespread, numerous, or causing significant itching, the dermatologist may prescribe topical or oral steroids. Other treatment options may include topical calcineurin inhibitors, cryotherapy, or phototherapy. In some cases, The lesions may disappear spontaneously without treatment within 1 to 2 years. However, if the lesions are long-lasting and emotionally distressing, they may require a more specialized approach, such as systemic immunosuppressants or excision. It's important to consult a healthcare professional if you notice any unusual bumps or rashes on your skin, especially if they are causing significant symptoms or affecting your quality of life. Number 10. Dry skin. Diabetes can cause dry skin due to several reasons. High blood glucose levels over time can damage nerves and reduce sweat and oil gland function, which can lead to dry skin. Additionally, individuals with diabetes are more susceptible to skin infections, which can also result in dryness. Avoiding long hot showers and using a moisturizer can help relieve dry skin. Use moisturizers as 4 to 6 times per day. Maintaining optimal good blood glucose level is must. Number 11. Itching. Itching can be a common symptom in diabetes. Itching, particularly in the genital area, is often caused by a yeast infection or thrush, which is a fungal infection caused by an overgrowth of candida. Diabetes can increase the risk of these infections, as the high blood glucose levels create an ideal environment for the fungus to grow. Other causes of itching in diabetes include dry skin, neuropathy, and poor blood circulation. If you are experiencing persistent itching can be treated with moisturizers, it will soothe you. Medications like gabapentin, antihistamines may also helpful. I hope you are enjoying this channel so far and I hope you subscribed already. Thank you.